Have you read the ingredient labels on most aerosol sprays? Most of them contain ozone-depleting chemicals, also known as chlorofluorocarbons or CFCs, and volatile organic compounds or VOCs. They cause the depletion of the ozone layer and have a negative impact on the human health. Now slowly breathe and exhale. Feel the pulses in your wrist. Can you feel and hear the whizzing, chest tightening, body aches, breathlessness, and blocked nose? You might have bronchitis. Bronchitis is an inflammation or swelling of the bronchial tubes or bronchi, the air passages between the mouth and nose and the lungs, a result of irritants like tobacco smoke, air pollution, or chemicals. We're constantly addressing the symptoms and not the underlying cause. So let us watch this video, which will provide critical information on assessing patients. In taking the health history of the patient or interviewing the client, select a quiet private setting. Choose terms carefully and avoid using medical jargons. Speak slowly and clearly. Use effective communication techniques such as silence, facilitation, confirmation, reflection, and clarification. Use open-ended and closed-ended questions as appropriate. Use appropriate body language. Confirm patient statements to avoid misunderstanding. Summarize and conclude with, "Is there anything else?"
Kagaya ko yung breakfast na mga ako. Hindi nag-ahali ko kahapon.
Hindi ako breakfast.
Ay, hindi.
Kailangan.
In assessing the vital signs, we're going to check for the temperature, pulse, respiration, and blood pressure.
Ask ko lang po kung kumain na po sila. Ano po kailangan nila? Lalagay po ba?
For taking the body temperature in the axillary region, we're going to wipe the thermometer from bulb to stem with alcoholized cotton ball. Place the thermometer into the hollow of the axilla with the bulb directed towards the patient's arm, or ask the patient to do so. Wait for appropriate amount of time until the sound is heard. While waiting for the time, the healthcare provider can now assess the other vital signs. Afterwards, remove the thermometer and wipe it from stem to bulb using a firm twisting motion. Read the thermometer and document the findings.
Tapos pulse rate, 88 po. 88 beats per minute.
In getting the respiratory rate, place the client's arm across the chest and observe the chest movements. Count the respiratory rate for 1 full minute. An inhalation and an exhalation is counted as one respiration. Observe the depth, rhythm, character of respiration.
Respiratory rate niyo po ay 18. Ngayon po ibibigay naman.
Taking the blood pressure, the elbow should be slightly fixed with the palms of the hand facing up and the forearm supported at heart level. Expose the upper arm. Wrap the deflated cuff evenly around the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. Place the lower border of the cuff appropriately 1 inch above the antecubital space. Palpate the brachial artery with fingertips. Close the valve on the pump by turning the knob clockwise. Pump the cuff until you no longer feel the brachial pulse. At that pressure, the blood cannot flow through the artery. Note the pressure on the sphygmomanometer, at which pulse is no longer felt. As the pressure falls, identify the mammometer reading at each of the 5 paces if possible. Deflate the cuff rapidly. Wait 1 or 2 minutes before making further determination. Remove the cuff and document in the client's record. The general considerations in the examination of the chest and lungs are the following. 1. The patient must be properly undressed and gowned for this examination. Ideally, the patient should be sitting on the end of an exam table. The examination room must be quiet to perform adequate percussion and auscultation. Observe the patient for general signs of respiratory disease, such as finger clubbing, cyanosis, air, and hunger. Try to visualize the underlying anatomy as you examine the patient. First, an examination of the chest and lungs is the inspection. Observe the rate, rhythm, depth, and effort of breathing. Note whether the expiratory phase is prolonged. Listen for obvious abnormal sounds with breathing such as wheezes. Observe for retractions and use of accessory muscles. Observe the chest of asymmetry, deformity, or increased anterior-posterior diameter. Confirm that the trachea is near the midline. Next is palpation. Identify any areas of tenderness or deformity by palpating the ribs and sternum. Assess expansion and symmetry of the chest by placing your hands on the patient's back, thumbs together at the midline, and ask them to breathe deeply. Check for tactile fremitus. In assessing for the tactile fremitus, ask the patient to say 99 several times in a normal voice. Palpate using the ball of your hand. You should feel the vibrations transmitted through the airways to the lung. Increased tactile fremitus suggests consolidation of the underlying lung tissue. Now for the bronchophony, ask the patient to say 99 several times in a normal voice. Auscultate several symmetrical areas over each lung. The sounds you hear should be muffled and indistinct. Louder, clearer sounds are called bronchophony. For egophony, ask the patient to say E continuously. Auscultate several symmetrical areas over each lung. You should hear a muffled E sound. If you hear any A sound, this is referred to as egophony. For the whispered pectoraloquy, ask the patient to whisper 1, 2, 3 several times. Auscultate several symmetrical areas over each lung. You should hear only faint sounds or nothing at all. If you hear the sounds clearly, this is referred to as whispered pectoraloquy. Next is percussion. Hyperextend the middle finger of one hand and place the distal interphalangeal joint firmly against the patient's chest. With the end of the opposite middle finger, use a quick flick of the wrist to strike first finger. Categorize what you hear as normal, dull, or hyper-resonant. Practice your technique until you consistently produce a normal percussion note on your partner before you work with patients. For the auscultation, use the diaphragm of the stethoscope to auscultate breath sounds. For the posterior chest, Auscultate from to side and top to bottom using the pattern. Omit the areas covered by the scapulae. Compare one side to the other looking for a symmetry. Note the location and quality of the sounds you hear. For the anterior chest, auscultate from side to side and top to bottom. Compare one side to the other looking for a symmetry. Note the location and quality of the sounds you hear.
Wala namang abnormal sounds. Wala namang po nakita mga bronchovesicular sounds. Pero mga normal sounds lang po. Narinig ko nung nag-auscultate po ako. Wala naman yung color din po nung fingernails na po naman po sila. Pati po yung lips na po.
And lastly, we are discussing our advocacy regarding the use of aerosol sprays, the abouts, do's and don'ts, and their implications in the environment as well as in the human health. Also, we are going to discuss our chosen disease commonly present in our community, which is bronchitis.
Okay na, aerosol sprays at Baygon po. Resistance. Yes. Okay, kuya kasi po, yung aerosol sprays po, nag-release po sila ng CFCs o chlorofluorocarbon. Pwede po natin dahil pwede po tayo magka-skin cancer, rashes po. At dahil po sa mga aerosol sprays, pwede po masira po yun dahil kung mag-react po ang chlorine sa ozone, nasisira po yung ozone dahil po sa reaction po nila. Mga solution po kami, ito po yung workshop po namin.
Tapos po, i-discuss ko po ang acute bronchitis. Ang acute bronchitis po yung pamamaga po sa maliit na daanan ng ating ng hangin papunta sa ating baga. Tapos po, ito po ay karaniwang po kapag tayo po ay naninigarilyo o kaya tayo naman po ay nasa alikabok na lugar, nasa maruruming lugar o kaya naman po ang katabi po natin ay positibo sa acute bronchitis tapos bigla pong umubo o kaya naman po ang pamilya po natin ay merong source ng ganito na nanggaling siya sa nanay mo o tatay mo. Tapos po, ang simple pong pag-ubo, pagsakit ng baga, o ang simpleng paglagnat sa pagsakit ng baga, maaari po siyang cause ng acute bronchitis, effect ng acute bronchitis, kasama rin po dito yung cause natin na yung paggamit po ng mga Baygon o mga aerosol sprays. Tapos po, pag may mga ganito na po tayong simptomas, pumunta na po agad tayo sa doktor, tapos po, pwede po tayong gumamit ng mga humidifiers bago matulog. Tapos po, pag lalabas po tayo ng bahay, mag-face mask po tayo para po hindi po natin malanghap yung mga usap. Yun lang po.
May tanong po kayo, any misunderstandings po about sa humping production? Sige po. Thank you po.
Repeat the procedure onto the next patients.